OptiVein IV-catheter is a novel catheter system for peripheral IV cannulation with advanced features. OptiVein IV-catheter is designed with aims to provide safer IV therapy, to increase patient satisfaction, and to simplify the cannulation process for clinicians. During cannulation, OptiVein IV-catheter emits green light from the tip of the needle. Visible light provides transillumination of skin tissues, and green light helps to detect the position of the tip of the needle under the skin and to indicate the moment of puncture of the blood vessel. Select the cannulation site and prepare it in accordance with institutional standard operating procedures. Remove the OptiVein IV catheter from its single-use blister packaging. Mount the catheter onto the OptiVein electronic unit and press the on-off button to activate the light. The green light illumination of the protective cap and adapter will appear. Remove the protective cap. Never look directly into the light coming from the tip of the needle, and never direct the light toward the eyes of patients or other people. Position the tip of the needle in close proximity to the injection site above the skin surface. Light is shining from the tip of the needle to the skin. Select the appropriate level of brightness of laser light. Penetrate the skin at an angle of 15 to 30 degrees and advance the tip of the catheter toward the target vessel. Observe the instant disappearance of the green light at the tip of the catheter, which is a sign of penetration of the wall of the vessel. Green light will be visible also through dark skin, but higher brightness of the laser light might be required. Stop advancement of the catheter and observe the first flashback of blood in the clear flashback chamber, needle flash, which confirms that the needle tip is in the vein. Lower the catheter to be almost parallel to the skin. Advance the entire catheter and needle as a unit slightly to ensure that the catheter tip is in the vessel. Advance the catheter off the needle slightly. Observe a second flashback of blood, catheter flash, between the needle and the catheter to confirm that the catheter is successfully in the vessel. Once the catheter is advanced completely, release the tourniquet. Occlude the vein distal to the catheter tip to disrupt the flow of blood. Stabilize the catheter hub to prevent catheter dislodgement and withdraw the needle straight out of the hub in a controlled and continuous motion. Connect the infusion line or syringe to the catheter hub to start IV treatment. Stabilize the catheter and apply a sterile dressing according to institutional SOPs. Switch off the OptiVein electronic unit by pressing the on-off button for 1 second. Dismount the needle from the OptiVein electronic unit with a single counterclockwise turn by using the Easy Dismount feature compatible to sharp containers or manually. Discard needle immediately into a sharps container. Never reuse the needle or catheter. OptiVein IV catheter includes all the parts and functionality of the traditional IV catheter. OptiVein IV catheter has a thin optical fiber, which serves as a light guide, placed in the needle. The light guide is made from a biocompatible, transparent plastic. It was tested for reliable optical and mechanical performance. The plastic fiber is positioned inside of the needle. It never comes out from the bevel of the needle. Attach the electronic unit to the catheter by rotating the electronic unit until it is firmly attached to the catheter adapter. Press the on-off button for 1 second to activate the light of the electronic unit. Notice that the laser safety mechanism, shutter, prevents the electronic unit from emitting laser light if the catheter is not connected to the electronic unit. To change the brightness of the laser light, shortly press the on-off button. The clinician can choose between 3 levels of brightness of the laser light. As a general rule, light-colored skin and superficial veins require lower brightness of laser light. The OptiVein electronic unit is powered by CR2 batteries. A battery low condition is indicated by one of the LEDs, corresponding to the power level, flashing. The battery should be changed immediately to ensure proper operation of the OptiVein electronic unit. To replace the battery, unscrew the battery compartment cover, remove the old battery, and insert a new 3-volt CR2 non-rechargeable battery. There are a number of different ways the device can be held, based on the user's preference. These are the most common grips that are used. OptiVein IV catheter is supplied sterile in a single-use package. It does not require additional cleaning or sterilization. It is a single-use product and should be disposed immediately after use. OptiVein electronic unit is a multiple-use device. It should be disinfected every time, before and after use, by applying an appropriate disinfecting wipe in accordance with institutional SOPs, for example, alcohol or chlorhexidine wipe. OptiVein IV catheter, when mounted onto activated OptiVein electronic unit, is a low-risk Class 1 laser device. The laser light is so weak that it cannot cause damage to skin tissues, veins, or blood. OptiVein IV catheter is designed to increase the first attempt success rate, to make cannulation simpler for operator and patient, to reduce the number of attempts, and to save time of highly qualified professionals.